Hello, all the listeners of Health Education Lecture Series. I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 7021 Village Parkway, Dublin, California 94568, and my phone number is 408 687 1899. Email address Homeomedicine, HOMEOMEDICINE at yahoo.com. Anytime for any disease at any age, when you are suffering and desperate for any treatment, please call me back at 408 687 1899 for your best suggestion or a best homeopathic treatment as well. So, this is the time for the next lecture of health education lecture series. And in this health education lecture series, how the life is created from life, a series of lectures we are delivering, how the life is created from life. And in that series of lectures, we have reached at a third stage, at a departure time of the baby from the mother's womb, and that is known as labor. And this labor is indicated by pains. Life is the creation of pain. It's not easy. Even a seed grows from the earth, it's not easy. Seed has to rupture, it has to come up from its own hole, and after that, from the earth as well. The same way, the creation of life is not as simple. And we have described every step of this life, that how this life was created, was begun, how this life was begun and ultimately developed, and now it is at the stage of departing from mother's womb, and that is known as delivery time. And in this delivery time, to understand easily this process, though it's a process of only about 12 to 16 hours, after that is the maintenance. Even then, maintenance, we should include it, uh, because we check the baby after that, and we watch it at least for 2 hours, for all the developments of the feces, of the urine, of all others abnormalities, anomalies, all that we check. So means we can say it's not more than a 20 hours phase that we have to check. This is known as labor period. And to understand this labor period, we have divided this into three types, three phases. The first stage of labor, second stage of labor, and third stage of labor as per its progress. As the baby is coming out of mother's womb, step by step, from this to this is the first stage, from this to that is the second stage, and from that to onward is the third stage. This is what I have told you in the previous lectures, that first stage is from the beginning of the labor pain up to the full dilatation of mother's womb, means uterus, cervix, so that a head, so that a part of the fetus can pass normally from that one, though it's painful, though it has to come with the pains, but even then it's still possible that the head can pass from this area. So that That type of dilatation, that diameter of the dilatation is known as full dilatations, and that is considered to be 10 centimeter. And beyond that, still there is one other thing that is known as the pelvimetry, means the distance of bones from bones, so that when the head comes, when the other body parts comes, the vaginal area, that is the whole pelvic brim is formed by the bones. They give sufficient space to pass on the baby. So that is known as the pelvic area. And if that pelvic area does not allow, it has also specifications, does not allow the fetus to come into and go out, then it again creates complications. Therefore, we have the stages, and we have the management of all these stages. In each and every stage, there are complications. Though it's a normal process, physiological process of the nature, but even then there are some complications attached to this. That sometimes in a normal go of life, we feel hurdles, we become sick, we have some other problems. The same way, labor is a normal process of the nature, but even then in its normal process, there are some types of hurdles, because mother is attached to that, the environment is attached to that, the food and everything is attached to that. So there are many more other things which may cause some type of hurdles in the normal go of life. And that is why we have calculated the normal period of this labor, and normal period of each stage of labor. And if ever it increases than normal periods, then and at that time we should think, and we must think, and we have already data that at the first stage what can cause delay, inertia of the uterus or whatever it is, or disproportion of the pelvis, all these things. So, in the first stage, we have already what may cause the delay of the development of the first stage up to the normal. Then, after that, we have discussed about the characteristic of the pains, natures, and its frequency, and the show. And after that, the presenting part, and all these things we have already discussed in the first stage. And after that, we have discussed about the second stage of labor. So, second stage of labor, we have already discussed. It starts from the full dilatation of the cervix uteri, means mother's womb, full dilatations, and now the total expulsion of the baby, not the total expulsion of everything which was generated inside the uterus. That's the umbilical cord, and that's placenta as well, and there are some other membranes. So that is still the part of the second stage, that it has to pass. So we have discussed about this thing yesterday in this program, that the second stage starts from the full dilatation of the cervix uteri and up to the delivery of the baby. And within this periods, there are some other types of things which can come up as a complications, and those complications are uh, just like the lie of the fetus, means the position inside the abdomen, the fetus is not in a normal position. It may be upside down, that is known as breech presentation. It may be normal position, even the cephalic position, the head is downward, but even then the head has different positions, and that can delay the process as well. And the minimum normal process is that when the presenting part is the occipito-posterior positions, but there are other cephalic positions, the frontal position, the right frontal, left frontal, and there are some other conditions which sometimes can cause problems or delay in the process of the completion of second stage. And after that, we have already discussed which can cause delay in the second stage. That was the short of umbilical cord or long umbilical cord. Anything, anything can happen, can cause hindrance and delay in the second stage of this labor. And the second stage of labor has also multi complications. If the if this cord is small with the direction, placenta may be detached. If the cord is long, it may be strangulated around the neck of the baby, and that can cause a stillbirth as well. So all these things we have discussed, that how we have to manage that. In our yesterday's lecture in Punjabi and also in Hindi, we have described all these things. And then, if the child is coming out and there is a complications of the umbilical cord, and the placenta is being detached or partially detached because of the shortness of the umbilical cord, it may bring out uh, heavy bleeding at that times. Then you have to manage that. And ultimately, the care has to be taken that there should not be a rupture of the amniotic sac. If the amniotic sac will be ruptured under these conditions, that blood will go into that sac, and that will be ingested, engulfed by the fetus, and that can cause problems for the fetus. That's known as aspiratory pneumonia or all these things, which can cause breathing problems in the just in the beginning of the child. And we have to take care of that one, so not to rupture the four water bag at that condition. Second, we have discussed if the cord is long and strangulated around the neck of the baby, then under what conditions, what will show, small cord or this long cord, what will show us, it will show us the distress of the fetal heart sound, which we check time to time. Even in the first stage of the labor, we check timely, repeatedly, the fetal heart sound, whether it's normal or abnormal. If the fetal heart sound is normal, that is 140 per minute. But if the fetal heart sound at that time goes up to 160, even still, but it is during the pain. During the extreme of pain, if the fetal heart sound goes up to 160 or under that, that is still, you can say, adjustable. And but if the fetal heart sound, which has been learned now, that if the fetal heart sound is increased than 160 per minute during the extreme of pain or even without pain, because pains has the successive things coming and going, that we have already told in the first stage, the characteristic of pains. The period, first of all, starts after a long time, then the pain remains for a short time. Ultimately, the period is decreased, the time period of the pain is increased, and this weight is increased. And when the pain is increased, then if it reaches, the fetal heart sound reaches up to 160, even still there is it's variable. But if even without the paroxysm of the pain, the fetal heart sound is more than 160 or 60, then it is something questionable, and we have to take care of that. Whether will it be possible to deliver the baby in a normal way, or we need to adopt the other measures, because at this condition we have to relieve the stress of the baby in whatever way. If we diagnose that that the umbilical cord was small and there is a gush of blood coming from the detachment of the partial or complete detachment of the placenta. Under those conditions, we have to take care that the baby should be delivered within the amniotic sac, so that this blood should not go inside. And ultimately, we can adopt the measures that are known as, you can say, suction. Sometimes the connection is poor, sometimes it is disconnected. I'm sorry for that. So Uh, Under these conditions, we can adopt the other measures, that is suction or the forceps delivery, so that we can deliver the baby very fast. Other conditions: if the umbilical cord is long enough and it has been strangulated, surrounded around the neck of the baby, then even then, when there is a traction, it also makes the umbilical cord small. When then it makes the traction and the heat extreme of the pain, at that time also the baby feels strangulated. And the fetal heart sound is increased as a distress of the fetus, and that may be more than 160 per minute. Under those conditions, we have another measures to adopt, that within the because we are not talking about the bleeding at this time, because bleeding is not there. The cord is long enough. It is strangulating the neck of the baby, and we have to save that. Under those conditions, with the show up, if it's a what part of the baby is coming, is his head cephalic, that's known as cephalic position. And cephalic positions have other different things, just occipital posterior positions or frontal positions are like that. So at that conditions, we have to check the umbilical cord around the neck of the baby by your fingers. When there is an extreme pain, labor pain, at that time it will bulge out in the four water bag. And that at that time you have to clamp this umbilical cord from both sides. From both sides, one will be the fetal side, the other will be the mother sides. So then you have to cut it so that the breathing which was taken from the mothers should be should not be stopped, but we can make the delivery fast by forceps delivery. Okay, so that the strangulation will not hurt, will not cause any problem or strangulation in the neck. So under, because it has been now cut, with the pain, which was causing hurdle, which was not allowing the baby to go pass from the cervix area, now it will allow it. Now it will allow it, because the card was showing in the show up. Show up means when the four water bag comes outside, along with that card we see coming out. So it means it was strangulating the fetal neck. Under those conditions, when you cut it, it means that strangulation has gone. The neck is saved. There are techniques how you have to cut that to save the neck, so that there should not be any cut to the fetal neck or any other musculatures. So in this way, when you cut it, and with the extreme of the pain, it has been experienced that the fetus is delivered, especially the head, immediately after that, because it was causing a hurdle at that time. Uh, Under those conditions, the first thing you have to take, that you have to clean the eyes of the fetus. Okay, because there is no bleeding, because the already umbilical cord has been cut down, and the mother parts is over there. Under those conditions, because the it goes this fetal umbilical cord from the placenta, it goes inside the and this water bag, and reaches to the umbilical cord of the baby. So it has its own junction, which is tight enough that the amniotic fluid will not come out, or anything from the outside, even if there be any bleeding, will not go inside. So that's the protection, already protection. So in this way, when the cord is cut in this way, in the extreme of the pain, the baby is delivered very fast. Or even you can apply forceps delivery, even you can apply suction matter, so that there should not be any delay in the delivery of the babies. And under those conditions, after that, second thing you have to do when the head is already delivered, I have explained many times that the second thing is to deliver the shoulders, because shoulder girdle is more larger than the head. Head is a smaller area, that's we are considering it 10 centimeters in circumference at that time when the baby will be delivered, but the shoulder is little more than that. And for that, nature has already its procedure to change the position of the baby 1/8 of a cycle means 45 degree. The 45 degree fetus automatically in the mother's womb moves so that the longitudinal, the from lump side, you can say the upper portion, and because mother's genital organs are from upside downward. Mother vaginal area, it is from upside and downward, from where the baby has to be delivered. It means it allows, that's known as the pelvimetry. It allows the shoulder to deliver, and when one shoulder is delivered, it's automatic process. It's automatic process. The child moves our backside 1/8 cycles, and then the second shoulder is moved, and after that it's very easy for the delivery to come out. And in this condition, when both the shoulders are delivered, and then very easy for the other portions of the baby to be delivered in this phase. And but for that, to make urgency, if you are applying forceps delivery, if you are applying sections, you must follow the rule of changing or rotation of the baby. 1/8 cycle one side to right or left, 1/8 cycle back to right and left, so that you can follow the nature's rule, because nature has to move the baby to deliver the one shoulder than the other shoulders. But even if you are using the suction, if you are using the forceps delivery, and if you are not following the nature's rule of this one, sometimes you can hurt the sides of the vaginal area, and even sometimes there may be rupture of the cervix uterus, orifice of the cervix of the uterus. So these things should be taken care of. That is a normal procedure nature adopts in a normal delivery way, and that you have to must adopt, even if you are making artificial means to make it fast, forceps delivery or suction delivery under those conditions. And after that, I have told you, first thing, you have to clean the eye of the fetus, because sometimes the ladies are having some type of infections, that is UTI, urinary tract infections. Sometimes it may be vaginal infections, because there are Dodderlines bacillus, which are the permanent resident of the female vagina, to clean it up, just like you see in the strovers, in the ponds. We keep the fishes, all that, to clean it. The water will be cleaned, and whatever is comes over there, they eat up, they engulf up. In this way, in the vaginal area, the nature has put Dodderlines bacillus. We know them as a Dodderlines bacillus, and they remain in a limited quantity inside the normal vagina, so that there should not be any smell, there should not be any infection. And even when the sperms after intercourse goes inside the vagina, they kill them. If there is no chance of pregnancy, if some of the cells survives and go upside the vagina, but all other are killed by these Dodderlines bacillus, because these are foreign bodies, just like America is pulling out many of the peoples to India or to various countries. So they are foreign bodies. Under those conditions, another one more thing comes, that WBCs, white blood corpuscles, these are the fighting forces of our body. Though these also act in these conditions to kill them, if there is anything like sperms or anything else. But now I'm talking at the time of delivery, when the baby is coming up, and sometimes the lady, because of the increased number of the Dodderlines bacillus, because if they are normal numbers, yes, there is no smell from the vaginal area. But if they are increased in number, yes, sometimes there may be any other infection may come up, because increased number of police, increased number of military shows that there is some type of problems. Under those conditions, they cause their own infections, they cause their own problems. Excess of police in area, that cause again another problem to the societies. In the same way, if the Dodderline bacillus are increased, even if the WBCs are increased, they cause another problems. So in this way, we are now delivering the baby, and we have to take care of the passenger first of all. Under those conditions, there may or may not be, but even then, it is advised that when the head is delivered, you have to clean the eyes of the fetus, so that they should not be hurt by the infection of the vagina or by the infection of the urinary tract. That to save that one, you have to do this thing at the same time. And then after that, in the second phase, pain, you can say, in the second pain, the full baby will be delivered. It's a movement type. It's not that big time it will take, because after that, the pains are coming even after 2 minutes, after 3 minutes. It's not that big times. You will clean the eyes, and second pain will come till that, and ultimately the baby will be delivered. You have to take care of that. Now, next complication which can arise at this position: head is coming out from the uterus, shoulder has come up already from the uterus, but now it's in the vaginal areas. And the vaginal area is supported by the musculatures and the bones of the pelvic brim. Pelvic brim is formed by the pubic bone, by the sacral bone, by the iliac bone. These three bones forms the pelvic brim. And that pelvic brim is not, that's known as the pelvimetry. The pelvic brim is not allowing the full space, so that the head should be delivered normally. Under that condition, there will be a tension in the vaginal area, and sometimes, because up and down, it's a vertical. The vaginal area is a vertical at that time. It may rupture the lower end of the vagina. Lower end of the vagina. And I told you many a times, repeating it again, that there is a space between the end of the vagina up to the opening of the anus. From opening to vaginal area, there is an area known as perineum. And that perineum is a junction box, just like our junction box controls all the connections of the electricity in our home. In the same way, it's a junction box over there, which supplies the nerve supply to the female or male genital organs inside the abdomen. And if there be any rupture to this area, that will cause more severe pain even later on after the delivery. Sometimes during the delivery, lady may or may not feel, but after that, it's a long time pain that lady has to suffer from the rupturing of the perineum. So our protection, our full intention should be at this stage to save the perineum, that the perineum should not be ruptured. What you have to do then, for the management? First thing, it is advised that you have to hold the head upward, upper portion, because upper portion is already widely dilated. Pelvic bone has already from upside has been dilated. There is a space between the pubic bones, and that has been dilated. So there is a still space that it can dilate a little bit more. So you have to lift the head upward. And even if this space is not sufficient to deliver the full baby, then you have to take care of the labia majoras. Labia majoras are the outer lips of the vagina, female vagina, and you have to cut that labia majora from one side. That is known as episiotomy. In a small surgical intervention, episiotomy, and when you will cut that, it will again give more space to deliver the baby. So you can deliver in there. Sometimes, under some condition, if the head is larger more than normal, just like hydrocephalus and all other conditions we have already discussed, what are the abnormalities of the fetus in the mother's womb? When it's developing, there is some condition arises in the fetus, that the head is larger more than normal, or even some other organs may be more larger more than normal. Under those conditions, sometimes we need to do this episiotomy on both sides, because at this time it's not the time that you can go for cesarean sections. Already shoulder has been delivered, already head has been delivered. So in this condition, it's not the time, it's in the vaginal area now, not the time that you can go for the cesarean. So you have to deliver the baby from the normal vaginal route, or from this route you have to sometimes need to cut on both sides of the labias. And then after the delivery of the baby, if you have not cut it, because there was no shortage of umbilical cord. If there was no strangulation of the cord, it was a normal thing, but the head was larger. Under those conditions, the first thing you have to do after the complete delivery, even with the episiotomy one-sided or bilateral, you have to deliver the baby, and after delivering the baby, you have first thing you have to cut the cord, and that cutting the cord has a specific name that is known as golden hour. That golden hour, that now it is being separated from the mother. It was attached to the mothers, but now mothers were feeding him, mothers were giving oxygen to him, but now it will be on its own. And then you have to cut the cord. The same process you have to adopt, that you have to cut the cord from clamp the cord from both sides. And then in between, first of all, it should be, the first clamp should be 2 inches from the fetus umbilicus, and then 1 inches from the fetus umbilical, and between that you have to cut that and make the antiseptic measures for that, for both the ends, so that there should not be any infection goes to the mother, and there should not be any infection goes to the fetus. And then after that, the second thing, you have to clean the respiratory organs, nose, throat, all that. And my procedure, when I was doing this one in Manavakendra Homeopathic Medical College, Ludhiana, or Lord Mahamir Homeopathic Medical College, I was the chief medical officer over there. Under those conditions, what I was doing, I was holding the feet of the fetus in my left hand, and I was cleaning the nose and mouth by making it upward and cleaning the nose and mouth. And even with the gravitation, maximum fluid, mucus, and everything automatically comes from the mouth outside, and we have to clean. In a rare condition, sometimes we need to give oxygen, we need to give mouth to mouth respiration to the fetus, and then we hand over it to the nurse or the assistant. After that, your second work is to wait for the placenta to come out. But before that, when the placenta will come up, it will bring up a big bleeding and all that. Then it will be more complicated in this way, because any infection or anything circulating inside the mother's blood may complicate the wound that you have caused by the episiotomy. Under those conditions, you have to take care of the wound. You have to stitch it on both sides or one side, whatever you have done the episiotomy. Then you have to clean and stitch it, and then after that you have to wait for the placenta to come out. That, up to this one, is our second stage. So now the second stage is complete. When the fetus is delivered, second stage is complete. After that, there is a phase of third stage. The third stage starts after the delivery of the baby. Then what remains? There remains placenta, there remains umbilical cord, and there remains membranes, inner linings of the uterus. And you know that during menstruations, bleeding comes as a menstruations. Plus, with that, if there is a unfertilized ovum every month, because if the girl is not married and there is no sexual type of things at that time, every month the ovum is prepared and comes into uterus but not fertilized, and it goes outside with the flow of the blood. Plus plus the inner lining of the uterus comes out, that's known as membranes. Inner lining of the uterus comes out, that is known as membranes, and that's endometrium. But now when there was a pregnancy, we changed the name of this inner linings of the uterus, that is called decidua. So now you have already taken out the baby, and surrounding the baby there was the inner lining of the uterus, that was known as the endometrium. So first of all, this placenta will come up, all will deliver, means umbilical cord will deliver, all these things. The normal period of placenta after the delivery of the baby is from 5 minutes to maximum 30 minutes. If it's delaying, it may cause infection. You should take care of that one. Antiseptic measures all the way. There should not be. But but it may attract infections at that time. If it's taking long time, if it's taking even more than 30 minutes, long time, then you have to manual and do something to extract the placenta at that time. There are many more means we adopt that one. That is the third stage management, that you have to tone up the uterus from the abdomen. Just grip the uterus above the abdomen, then pull it, leave it, pull it, leave it. If you will do it this thing, ultimately the uterus, which has become weak, inertia of the uterus, that's called the inertia of the uterus. The uterus has become weak after the delivery of the uterus. That's why it's not pushing up the placenta outside. It's not detaching the placenta outside. So for that, you have to massage the abdomen. You have to grip the abdomen, fundus of the uterus, throw the abdomen, and then leave it. Push it, leave it. Catch, tract, leave it. Ultimately, in this way, that placenta will be detached automatically. Another thing, automatically, oxytocin hormone that is produced by the anterior pituitary of the brain, that is also still continuing. And even if you have already given outside injections of the oxytocin hormones, that is also working over there. And in that conditions, they are already working to detach the placenta and pull it out. But sometimes there's a deficiency of oxygen, the oxytocin. Sometimes there's the inertia of the uterus. Uterus is so weak that it is not pushing up the placenta outward and not detach the placenta outward. Under those conditions, you can adopt these mechanical means. You can put at that time, because there is a full dilatation. When there is a full dilatation, you can give outside help, that is the oxytocin injections. You can give at that time, which will facilitate and will deliver the placenta in a moment. So minimum time period after the delivery of the fetus for the placenta is 5 minutes. From 5 to 30 minutes is the maximum periods. But if it takes longer period, then you have to take measures about that, because it may cause sepsis of the. If you, I have noted many in my childhood, in the villages, when there was no facility this type, and practical persons were not there, ladies were dying with sepsis. Ladies were dying with tetanus. We even fetus were dying with septic. All these things were happening in these conditions because we were persons, knowledgeable persons, as a medical profession were not there. Untrained dies, midwives in the villages were working, but they do not know about these procedures. That is why ladies die, fetus die, even after normal birth of the babies. It happens. So, first thing, we have to take care of the baby and also of the mother to save from the septic focus. And if there is a placenta, that's known as retained placenta, and a retained placenta may cause a complication of the septic. So you have to take care of that one. If it's taking a little longer time, then by manual attractions, you have to detach the placenta and bring it out. And after that, the membranes come. That is the inner lining, that is now known as the remaining portion of the decidua. That remaining portion of the decidua comes after the placenta has been delivered. So these are known as the membrane, delivery of the membranes. So sometimes the delivery of the membrane is not complete. And sometimes the delivery of the placenta is not complete. That can cause flood of bleedings after that. Flood of bleeding after that can make another complication for the females, that you have to take care of. You have to check the pulse of the female, blood pressure of the females, and even if required, if there is a gush of bloods at that time, you can start intravenous infusion to that one. Even of the blood sometimes is required, even glucose may be required, so that it will decompensate it, because some of the blood portion remains in a position in the spleen. Our spleen is a storehouse of dry blood. You can say the dry blood. and you can that is immediately delivered into the bloodstream. And if you add water, if you add glucose, immediately they swell up, the cells swells up, they become the normal blood cells, and that can serve the purpose. This is what the normal physiological features are. In this way we can save the mother at that time. But even then, sometimes you might have noted that some membrane remains inside. After that, contraction is a normal thing. Primary action has secondary action, it's a normal thing. In the primary action, the placenta was taken out, and also with the pains, the membranes were taken out. But even then, after that, there is a secondary action which will contract the blood vessels, and bleeding will stop. Now, this period of stopping the bleeding, it is related with two factors. One factor is the bleeding factor. We consider it a bleeding factor because every person has a limited bleeding factor that is, you can say, 3 minutes maximum. Within 3 minutes, the excess bleeding which is coming up from any tear, it stops. But if it's a big vein or anything has ruptured, it may take longer periods, and that needs to be contracted with your injections that you have already given from outside, and even from the interior pituitary gland that comes after that, contract the blood vessels, and bleeding stops. But the residual remaining inside the uterus, that takes about 6 weeks. Altogether, stoppage of the discharges from blood to the mucus to the watery discharge to the yellow color of discharge, that is known as lochia, Lochia, lochia. That period is known as purpurium period. That takes about 6 weeks, 1.5 months. 6 weeks that you have to follow up that, and during this period you have to take care of the infection, so that mother later on should not suffer from any different kind of tetanus type of infections, or any septic type of infections, or any Deadrolines bacillus infection, or any Diplococcus staphylococcus. They may come from the environment, and if she is using any other type of infected cloths, that may come up. So sterile gauze pads should be advised at that time, and this period takes about 6 weeks to complete, purpurium period. So I think this is the management: taking care of the vagina if there is a tear, taking care of the cervix if there was any tear, taking care of the bleeding if it's coming in gushes and there is still remaining portions of the placenta. You have to check the placenta. And regarding the placenta, I have told you astonishing thing of the nature, that in one cup there is a two type of juice. Just like you see in the go to near some areas of the sea, they on one side the water is clear, and the other side the water is green, other side the water is blue. Different kind of water you see, but there is no wall in between the sea, but the color of the water is different. Okay, and that's a different thing. I'm not going to waste time on that one. Most of the people know better than me, but here I can tell you, in the placenta, the blood which is coming from mother side, that is full of oxygen and food, means that is heavy. And the blood which is coming from the fetus side back to the placenta, that is deoxygenated. Carbon dioxide and other nitrogen, or all that, those gases which were collected as a garbage from the cells of the body of the fetus, they are coming back to the fetus, to the placenta. So oxygen is heavier than the other gases, so they remain on the base. They remain on the base, mother sides. So the mother side of the placenta is reddish in color, whereas where the umbilical cord in the middle of the placenta is attached, that is blue in color, because that is deoxygenated blood coming from the fetus. So that is deoxygenated blood. So there is a one placenta, there is no wall inside that, but two type of blood remains inside the placenta. Back side, mother's side, that is reddish in color. Fetal side, it is blue in color. But we have to check the placenta regarding its diameter and the completeness. The diameter of the placenta is 20 centimeter, and the weight of the placenta is one half pound. Okay, from 1 pound to one half pound. So this is the measurement of the placenta at that time when it is delivered. You have to check this one so that you can make sure that the complete placenta has been delivered. Complete placenta has been delivered. If any portion of the placenta is still remaining inside the uterus, the bleeding will not stop. It will continue bleeding, and it may cause another infection and serious condition of the females. That sometimes, even in my experience, that sometimes needs to curate, to mechanically remove that placental pieces. And even sometimes the endometrial layer, the decidual layer, sometimes they are not coming complete outside. Suppose if within a week the bleeding is still coming bright bleeding, it means some portion of the placenta or some portion of the membranes, that's the decidua, the inner lining of the uterus, is remained inside and they are bleeding. That you have to take care, that if within a week the color of the bleeding has not changed, it is still bright red, then basically mostly we advise it changes after 3 days. It changes after 3 days. But if it's still bleeding, heavy bleeding and red bleeding coming up, it shows that some membranes are still there, or one portion of the placenta or anything is still there, which is bleeding outside. Then you have to take care of that one, so that uterus from inside whole, it should be clean and should be prepared for the next menstruation to prepare the endometrial layer, because every month this layer is prepared by the under the effect of LH hormone and follicular stimulator FSH hormone. They are after that they are continuously generating, and they take care of the inner lining of the uterus. But if there is any old piece, then they cannot complete their cycle. They cannot form the inner lining of the uterus as a complete. So you have to take care of that. Otherwise, sometimes you might have listened that, oh, lady, after delivering one baby, there is no baby after 10 years continuously. Why? After 5 years, no baby. Because some of the remaining portions were there. They are known as moles, and they develop one to multiple moles. I have seen ladies, they are having big moles, and the uterus is full of moles. Different pieces remains inside the uterus, and that's known as a molar pregnancy. But there is no pregnancy, but that's known as molar pregnancy because the signs of the pregnancies are there. If any piece, sometimes this type of piece remains over there, there are positive signs of the pregnancy, but there is no pregnancy. So, to save all these conditions, you must be assured that all the portion of the membrane, all the portion of the placenta has been delivered, and the uterus lining, that's the muscular linings. Uterine linings inside are clear now, and then automatically the secondary effect of the hormones, it contracts. And I have told, when we were discussing about the menstruations, I told you when the bleeding goes out, after that, level of the estrogen during the menstruations, level of the estrogen falls down in blood of the females. A signal goes through the brain, and ultimately another hormone grows over there. That hormone is known as follicular stimulating hormone. Means that starts growing. That starts growing something, just like they start growing oocytes in the uterus. Okay, and then that becomes ovum later on and all that. So that process automatically starts. And if something is remaining of the previous pregnancy or some of the previous menstruations, this process of generating the follicular stimulating hormone in the pituitary gland will not start. Will not start, then the previous thing will continue. So these are the things we have to take care under this management of the third stage. But there are still many other things, just like we have discussed about the taking care of the placenta, taking care of the air passages, taking care of the eyes, and taking care of the fetal heart sound at that time. You must be aware of this thing, that during the pregnancy period, right atrium to left atrium, because there is a wall between the atrium and the ventricles, and there are two ventricles, two atriums, and there is a complete wall, atrioventricular septum, and the upper portion is known as atrium, the lower portion of the heart is known as ventricles, and there is no junction between the ventricle to ventricle, there is no junction between the atrium to atrium in our body. But in the fetus, I have told you, in the fetus, there is a hole that is known as foramen oval, and that was during the period of pregnancy, it was supplying blood directly to the left side of the heart from where it goes to the whole body, because at that time lungs were not working. At that time the pulmonary artery, which is supplying blood to the lungs for cleaning it, for supplying the oxygen to it, is not working, that is plugged up. And so the blood into the right ventricle was not going, because it was directly going to the left atrium. From the right atrium, when it comes from the other outside of the sources of the bodies or from the mother, it goes from right atrium to the left atrium because of that hole, and that is foramen oval. And that foramen oval starts closing after the birth of the child, but it's not that quick. It takes time. The normal period, we think it within 18 months of life, 6 months to 18 months sometimes, it takes time to close completely that foramen ovals, so that the blood can go downward to the right ventricles, and from there to the lungs. As I told you, all happens, this mechanism happens because of the environmental pressure. 480 millimeter of mercury pressure, which is the environmental pressure on us. That pressure causes the valve from right atrium to the right ventricle that opens. And when that opens, the blood from upward goes downward, and it is already pushed from the pulmonary artery to the lungs. And the lung opens also with that pressure. So everything continues. Now I'm saying that after the delivery of the child, that foramen oval is still patent. Patent means open. That foramen oval is still patent, and you will listen the heart sound. That's the heart murmur at that time. You must be knowledgeable for that one, so that you can recognize that this sound is from the foramen oval. Because I have already, when I was discussing the structure of the chest, I already told you that from the outside of the chest you can figure out where is your aortic valve, where is your pulmonary valve, where is your mitral valve, where is your tricuspid valves, or the valve which is from the left side and the right side. All these valves, they have their surface anatomy. You can see the surface anatomy from above the chest. You can recognize that this sound is of the pulmonary valve, this sound is of the tricuspid valve, this sound is the bicuspid valves. All these things you can recognize from the chest as well. So this way you can check it from outside, and then you will feel, oh, heart is palpitating 140 times per minute, and still there is a murmur. So ultimately, this heart beating gradually as the child grows, then it comes downward. Then it gradually comes downward. I will let you know how it comes down and all these things, because today our time we have taken even the time of Hindi period or the Punjabi period today. So tomorrow our lecture will be, first of all it will be in Punjabi and then it will be in Hindi, because today we have given more time to the English lectures, and we we eaten up the time of Hindi and also the Punjabi media. So we will compensate that one tomorrow, and we will again cover the complications of the third stage of labor. And most complication, the important complication is the bleeding. How to control the bleeding? That I will give you tomorrow, the full idea of the bleeding, how we can control this one after that one. So this is your host Gurdeep Singh Sandhu, homeopathy consultant. My phone number is 408-687-1899. Anytime you want to discuss any point, you can call me at this number, 408-687-1899. I'm resident at 7021 Village Parkway, Dublin, California, 94568. My phone number is 408-687-1899. Email address homeomedicine@yahoo.com. Homeomedicine, HOMEOMEDICINE at yahoo.com. You can call me anytime to discuss any point, or even without this labor sections, you can call me to discuss any disease, any portion of your problems which is related to the health. And wherever you are getting treatment, no problem, I can guide you what are the norms of the natures, how this nature prepare and make it healthy, our body, and what are those norms. If our treatment is going according to the nature's principle, yes, definitely we will get well soon and also permanently. But if we are going against the rules of the natures, we will not get cured permanently, never. It will come up again and again, it will come up again and again. And it's simple. Many times I have told you, there are 9 systems working inside the body. All the 9 systems are producing garbage, and the nature has its preparations that garbage is removed from the body by stool, by urine, by sweat, by breathing, all that. But any of the source, if it's closed, or somewhere if the garbage is increased in number more than normal, then there are problems. Then there are, you can say, the sickness, diseases. So unless we clean up all these systems, all these way outs, then we cannot cure the process. If the disease travels in these sources, after taking the medicine, any disease is not blocking any of the portion of this evacuations, yes, it's in the right way for the cure. You will be cured with that one. So Rabarakha, God bless you all. We will see you tomorrow, and at 5 we will start with the Punjabi program, and the complication of the third stage of labor, and what is the third stage composed of. All these things we will discuss tomorrow. Rab Rakha, Sat Sri Akal, Adab, Namaskar.